Community briefing on our ongoing pandemic response efforts. Providing interpretation for us again today is Margie Prop. Thank you so much, Margie. And thanks to everyone for joining us. Since our last briefing, the Omicron variant was identified in the United States. As of today, 19 states, including Nebraska, have reported cases. 6 cases were reported here in southeast Nebraska, but we have not yet had a case of the new variant in Lancaster County. As we work to further understand this new variant and its potential impact on Lincoln and Lancaster County, we continue to urge people to get vaccinated now and to wear a mask, actions that help prevent spread and provide protection against COVID-19. This is an evolving situation, and we will share more as we learn more. It's another variant, the Delta variant, that continues to have a big impact on our community right now. Delta continues to circulate at high levels, and our local situation is growing more serious. On Friday, we had 264 new cases, the highest number of new daily cases reported so far in 2021. Since late October, we have seen a steady increase in the number of new cases. When we look at the 7-day rolling average of new daily cases chart, you can see the average increase of 127 on November 24th. The dip from November 25th through the 29th was due to a drop in testing availability around the Thanksgiving holiday. Since then, we've seen a sharp increase, up to an average of 170 cases on December 4th. The pie chart shows cases from November 28th through December 4th, broken down by age. 3/4 of our current cases were under the age of 50 years old. In addition to the increase in new cases, the positivity rate has continued to rise as well. At the end of last week, the rate had reached 14.7%. This is the highest positivity rate we've ever reported locally. Positivity rate is an important indicator of spread in the community and shows the risk of transmission is very high. And then our hospitalizations have also been high since late October, and the 7-day rolling average has been in the 90s for most of November. Unfortunately, more and more people with COVID-19 have been seeking medical care and are being admitted to our hospitals. At the end of last week, the daily average was up to 106 patients. This is severely straining capacity, and our hospitals are struggling. Today, Bryan Health and CHI St. Elizabeth's reported 101 COVID-19 patients hospitalized. 65 of these patients are from Lancaster County. Last week, state officials shared that Nebraskans who were not fully vaccinated are 10 times more likely to be hospitalized with COVID-19. The chart you see now shows COVID-19 hospitalizations in Nebraska. The slim dark green area along the bottom are patients who are fully vaccinated. The large light green area represents patients who are not fully vaccinated. Currently, only 4 out of every 100,000 people who are fully vaccinated are being hospitalized each week. But 40 out of every 100,000 people who are not fully vaccinated are being hospitalized each week. Again, if you are unvaccinated, your risk of being hospitalized is 10 times higher than someone who is vaccinated. The data is clear. Vaccination keeps people out of the hospital. Joining us today is Russ Grenwald, who is the president and CEO of Bryan Health, and he will update us on the situation within our local hospitals. Russ?
Thank you, Director Lopez. So where do we find ourselves at Bryan right now? In some ways it's the same, and in some ways it's not the same. In the way that it's been the same, today we have about 68 COVID and post-COVID patients in the hospital. We normally run about 65 to 85. 80% of the patients in our hospital are unvaccinated. Of those under 50, 95% are unvaccinated. In the ICU, 90% are unvaccinated. This continues to be a pandemic and a crisis primarily of the unvaccinated. What's also the same is that all of our other volumes are high, and we remain accommodating those by requiring mandatory overtime and extra shifts from our staff. But there are some things that are not the same, and I would ask that they pull up, please, the overall patient count chart right now. You'll see on this chart that under the gray line, we typically have about 500 to 510 patients that we plan for and staff for regularly. You can see in the squiggly lines the overall midnight census and how it's been almost completely over that gray line for some period of time now. The red line is the temporary surge capacity line, and then anything over that is excess surge, which we accommodate through non-traditional beds of one sort or another. So we are now on the 23rd week of this surge. We were planning on 8 to 10 weeks of this surge. We're on the 23rd week, 17 weeks of which have been at peak, not 8 to 10 weeks. And so that means in order to accommodate this, we're requiring now even more additional mandatory shifts. What else is not the same, and maybe the most emerging story for us, is that there's no other capacity in Omaha, the rest of Nebraska, or any of the surrounding states. We regularly receive calls daily from all of the surrounding states, and all are reporting no additional capacity. That means that we are now turning away or putting on a wait list not just COVID patients, but all other critical care patients. It is routine for us now to have 25 to 30 patients on a wait list. And these are folks that are in serious condition. These include people with cardiac events, gastrointestinal bleeds, and septic shock just this week. There was a story that I read this morning about a particular patient in a critical access hospital who was about 30 years old, and they were trying to transfer this patient to us. The doctor and staff brought to tears, telling them that they could not transfer them despite the fact that they were having to put this patient on a vent with only a part-time respiratory therapist in the area. And we're trying to help some of them manage them in their current place, but this is not something that they're used to doing. Our staff and our physicians now are in a position where they are choosing literally hour by hour who gets the next empty bed. If all were vaccinated, if you can look at the lines that Pat showed or that were on the previous chart, if you looked at those lines, really we would be at about 30% of the total COVID that would be in hospitals right now as opposed to what is being reported in the hospitals. And we would be able to accommodate all of the requests coming our way. We wouldn't have to be making these very difficult decisions for us and for our doctors, but even tougher decisions for the patients and the families that we care for, or that care for them and are waiting for care. So my message, I guess, is just very simple. Please, if you've not already done so, please consider getting vaccinated.
Thank you, Russ, for taking the time to be here today with us and for your unwavering commitment to caring for the people of our community and the surrounding areas. Sadly, we have 4 COVID-19 deaths to report today. A woman in her 90s, 2 men in their 80s, and a man in his 60s. So far in December, we've lost a total of 6 members of our community, and we lost 16 members of our community in November. With increasing cases, a record positivity rate, and hospital capacity stress, the COVID-19 risk dial is moving from mid-orange to the elevated orange category. This means that there is an increasing risk of COVID-19 spread and impact in our community. On the color-coded risk dial map that you can see now, indicators spread across the different risk categories. Our high positivity rate and case rate are both in the highest red category. Hospital capacity and deaths remain in the orange category. Contact tracing is in the yellow category, while testing turnaround time and vaccination rate are in green. The position of the dial is shown by the blue square outlined in red, which can be seen in the elevated orange area. Much of what's driving the current increases is the aftermath of Thanksgiving gatherings. And we could see a repeat of this later in December as more holiday gatherings are planned. We must be mindful of our actions and remember to celebrate safely. In addition to getting vaccinated and wearing masks, it's important to get tested if you have COVID-19 symptoms, to stay home if you're sick, and to watch your distance from others and to wash your hands. Fortunately, more and more Lancaster County residents have now received first, second, and booster doses of COVID-19 vaccine. Data continues to show us that vaccination helps prevent severe illness, hospitalizations, and death. Vaccination remains an essential tool to reduce the impact of the virus and its variants on our hospitals and in our community. I really want to repeat what I said earlier. We urge all children and adults to get vaccinated or a booster dose now. Please don't delay. This will enable us to build stronger protection against the virus as individuals and as a community to better position us for what may come in the weeks and months ahead. And here's a quick rundown of the latest vaccination stats. About 63% of all Lancaster County residents that are eligible are now fully vaccinated. Close to 26% of our children ages 5 through 11 have now received a first dose, and about 13% of them are fully vaccinated. 37% of people age 18 and over have received a booster dose or a third dose. We are making strong progress, and vaccine supply is plentiful. There are still around 60,000 local residents aged 16 and older who are eligible for vaccine, but haven't yet received it. Locally, we have over just 21,000 children in the 5 to 11 age group who are eligible to be vaccinated. With the high level of transmission we are now seeing in our community, you and your family members need the protection that comes with getting vaccinated. Please get vaccinated now. We continue to hold several clinics each week at the health department and work with partners to hold additional clinics in the community to make it vaccine accessible, convenient, and close to home. If you're eligible to get vaccinated or a booster dose, schedule an appointment at an upcoming clinic at covid19.lincoln.ne.gov or go to your local pharmacies who are also offering vaccine. Go to vaccines.gov or text your zip code to 438829 to find the closest place near you. COVID-19 vaccine and flu vaccine can be given at the same time, and we encourage people to get vaccinated against the flu as well. Flu viruses also cause respiratory illness, and we are starting to see some flu cases in our community. And while that flu activity is currently low, we are likely to see an increase in the coming weeks. And this week is National Influenza Vaccination Week. It's a reminder that vaccination offers the best protection against flu. Flu vaccine not only helps protect you and your family, it can also help preserve hospital capacity during this pandemic. Flu vaccine is recommended for anyone age 6 months and older and is widely available. Contact your healthcare provider or go to vaccines.gov to find a location offering flu vaccine near you. And with that, we'll take any questions.
Pat, we have a question that came in on the chat. The question is, are you preparing any sort of MASH unit or any other type of community healthcare facility to take care of COVID patients in the event that case numbers rise much higher and hospitals are forced to turn away an increasing number of patients who need non-COVID care?
I'm going to ask Russ to come up and address that, but we can talk about crisis standards of care and what that means first, and then I'll fill in after that.
Currently, we are not looking at preparing for a MASH unit or a triage unit outside of our current hospital. That's certainly possible, but If we were to go these directions, we would look first to some of our critical access partners. One of the things that our pulmonologists have been able to do is create arrangements out in the rural communities. They're now staffing ICUs in about 9 different hospitals. They also have pulmonary access to about 23 total hospitals right now to provide additional help out in those rural areas. So that would be our first look, because we know that we already have licensed capacity there, and we believe that we would be able to probably more effectively take care of folks in those settings than standing up another MASH unit. So that's the initial plan.
Hey, Russ, while you're still up there,
Yes.
this is Matt Burding from the Journal Star. I just wanted to ask, UNMC today announced that they're gonna stop doing some elective surgeries again, and so I just wondered if you guys are looking into that at all or considering that step again.
We are limiting some elective surgeries already, especially those that have overnight visit or overnights. If they have one night, many times we're still doing those, but I think surgeries are being looked at continually all the way through. So the answer is yes, it's a constant conversation, and if things don't subside, obviously we'll probably have to take even more dramatic actions. The challenge with that is so many of these surgeries really aren't very elective any longer. The criticality of the surgeries that we are doing today, they really can't wait very long at all. But I can't say that we couldn't make any adjustments there if push came to shove.
Thank you.
Uh-huh.
And Director Lopez, we had another question come in on the chat. How has demand for testing been trending in the county over the last few months? Why is testing an important piece of combating the virus, and is there enough access to testing?
I'll answer that middle question first. Testing is really one of the other critical components of identifying individuals that are positive for COVID so that they can isolate themselves from other and prevent continuing to spread the disease. Since October, our testing has been increasing, and actually we've had really strong testing in Lancaster County. We've done, if we just look at from July to December to date, we've done 267,890 tests in our community. Our average daily testing right now continues to increase. We have strong testing going on in November and October, kind of increasing, as I mentioned. We also have strong testing going on at the university, and we adjust that testing based on their positivity rate and what's happening. We're very fortunate in our community that people have multiple sites to go to for testing and for care and for coordination. Our health systems have really done an outstanding job coordinating care and getting people in for monoclonal antibodies that need them, whether they appear in an urgent care setting or in a different setting. Both Bryan and St. Elizabeth's have done a tremendous job in preventing people from being hospitalized because they've been able to access a test and been able to be seen by a provider and know that they would benefit from the monoclonal testing. If we didn't have that available, our hospital capacity would be overstressed. We would be in crisis standards of care from that prevention. So there are multiple testing sites. People can get tests for no charge. If they have any problem, they can always call us and we will help them with that. So as I said, we are very fortunate. In some areas of our state, people have to travel an hour or 2 hours just to be able to get a test. So I praise people that are going in and getting testing done. That's one of the other ways they can help the community. But the most important thing is to get vaccinated and wear their mask right now. Okay. Well, thank you for joining us.
Pat?
Yeah.
Sorry, this is Matt Burding with the Journal Star. I had just one quick question for you. So I noticed case numbers have pretty much doubled in the past 2 months. but hospitalizations really have kind of stayed level. They've maybe gone up a little bit, like 10, 15%. I mean, if you look back to early October, we had around 90 people in the hospital, and we've got around 100 now, whereas cases have gone from 600 to 1,200. So, I mean, would you, I know I'm asking you to speculate here, but would you say that that is in some ways attributed to the number of people that we have vaccinated and the mask mandate and things like that? How people are still getting COVID, but they're not getting as sick and needing to be hospitalized at as higher rates as they were last year?
That is really helping, Matt. We do know that it makes a difference in what's happening, but what's really concerning too about our hospital numbers is that it's sustaining and then growing. You know, and you'll notice most of the patients are from Lancaster County, and many of them are in that younger age group. So those are things that are really concerning to us. And the other thing that we do know, especially if you look at the dashboard from Brian and what we know at our health department, these are primarily unvaccinated individuals. So that's why we keep stressing that we really can do prevention by being vaccinated. But all the other things that we've been doing in our community have really been helpful. You've probably seen that Omaha's numbers are increasing dramatically. And as you already mentioned about the hospital situation there, some of the concern that's actually going on in that community. And in talking to our other health departments across the state today, these are the same concerns they are having everywhere. And some of our larger health systems like Bryan and St. E's trying to help our critical access hospitals keep individuals on ventilators that the hospitals really aren't equipped or staffed to do, but doing the best to care for people. So this situation is really critical, and it's important, and I appreciate your interest in it, and I hope everyone listening out there really understands the role we can all play in making this better. Joining us today, and remember, please get vaccinated and wear your mask.